thank you for coming.
Thank you. Good morning. My name's Carol Sullivan. Thank you for having me, and thank you for that warm introduction. And also thank you for raising your hands to let us know who is in the room. This is a really huge topic, nutrition, when it comes to stomach cancer and esophageal cancer. So hopefully everyone's going to be taking away something from this presentation, but if you have not met with a dietitian, especially a registered dietitian who's a certified specialist in oncology, I would definitely encourage you to do that. They can really sit down with you and, pick out an individualized plan based on your preferences, based on what's going on, and really meeting with a dietitian across the continuum of your care can be really helpful. I've tried to kind of splice out, the before surgery, after surgery helpful recommendations, but I'm definitely not going to get to everything that I want to say today. So I would definitely encourage you to meet with a dietitian at some point if you haven't already. So our agenda is to go over just the general nutrition goals of what kind of the dietitian's always thinking about helping you with, how the RD can help, the nutrition during treatment, so what are the side effects a lot of times of chemotherapy and radiation, and how can nutrition help with some of those side effects. Just one slide about Immuno Nutrition and considerations prior to surgery, eating right after surgery, and then the long-term after surgery. So just thinking about the general nutrition goal, it's all about maintaining your weight, which we already know people usually present with significant weight loss, which is really defined as more than 5% in 6 months, more than 10% in a year of weight loss, which is not that hard to do when you think about all of the manifestations that can really result in weight loss when we're thinking about stomach cancer and esophageal cancer. So maintenance of muscle mass is really the goal when we say weight maintenance. We know if you're maintaining muscle mass, that is going to help your overall function, your energy. So that's really what we're saying when we say weight maintenance. So thinking about how we can always be adding more calories and more protein is going to be the job of the dietitian based on what your preferences are. So I like to use this word fortify. So always thinking about where you can fortify what you're eating. So if you're just eating oatmeal by itself, what else can you add? You can literally dump a kitchen sink worth of other high calorie ingredients into oatmeal, starting by making it with milk. So just as one simple example. And then always thinking about how can you add more nutrients. So how can we add something maybe that is a plant food that has not just vitamins and minerals that your body needs more of during treatment, but also all the other phytonutrients that we know exist in all of the plant foods that we eat that can be helpful as well. And then the second goal to weight maintenance is really good hydration. So I feel like it's my job to get a good account of how, see people nodding their heads, how much you're drinking in a day and how much you probably need in a day, and talking about where you can fit in more fluids. If it's impossible for you to meet your fluid needs, how can maybe we talk about getting additional IV fluids during the week, and how can that fit into your schedule if we can get that set up at home for you. I kind of take that on as my role, since hydration is so important in preventing nausea and also getting all those nutrients in your body where they really need to go, and also feeling like you have a little bit more energy. If you're well hydrated, your energy can be a little bit better. And the third thing I like to talk to people about, if possible, if you're feeling well enough, getting some kind of physical activity, since physical activity can help to preserve that lean body mass. And it doesn't have to be anything too strenuous. I like to put this picture up of the people walking on the beach in fall, because just getting outside and getting fresh air and moving your body and getting your heart rate up a little bit can do wonders. So just one slide about the growing body of evidence stating a statistical significance with nutrition intervention with a registered dietitian. So we know if you're working with a dietitian, you might be more likely to avoid breaks in treatment, less likely to have unplanned hospital visits, and actually a 2012 randomized control trial of colorectal cancer patients showed that nutrition counseling improved median overall survival by 2.4 years. We know that people are likely to have an improved quality of life and that performance status can be better. And then patients are also most likely to have less toxicity symptoms, which is huge. That means that your dose reductions might not be happening of treatment, so that's definitely an important goal too. I like to start by talking about why you might have a decreased appetite. You have all of these cards stacked against you, and I think decreased appetite and weight loss are really the most distressing of things that happen during this journey. So thinking about why this is all happening, just kind of, I think sometimes this creates a lot of tension among patients and caregivers. So really kind of breaking down what's going on can be beneficial. So we know physically there can be pain with eating due to irritation and swelling of the gut. Reflux and vomiting can be issues. So of course, you're having all of these signs that are telling you don't eat. So it's going to be hard to eat and it's going to be challenging. And then not to mention all of the psychological things that can happen with a cancer diagnosis itself. Increased anxiety, depression, and stress can all play a role in your appetite. And then third, the changes in metabolism that we know happen. We know that when there's a solid tumor, your body's metabolism changes significantly and you're actually pulling more protein from muscle as energy than you normally would, which is very sad for people that think, I want to lose weight, I want to lose fat. That's not actually what's happening. So that's the other huge reason that we're always encouraging to maintain your weight, even if you feel like you have weight to lose. So addressing poor appetite, if you've met with a dietitian, you've probably been through all of these examples, but I think the most important thing when it comes to eating is thinking about your meal patterns. So it's also whatever sounds the easiest to you in terms of how many times a day you're eating. I know the blanket statement is eat 6 small meals a day. To me, that sounds overwhelming. I'd rather think about it as I'm eating breakfast, lunch, and dinner, and then how can I insert 2 or 3 small snacks into the day? And that means, you know, I already eat breakfast, lunch, and dinner, and maybe 1 snack a day. It doesn't sound as overwhelming as eating 6 times a day. So I like to present it, you know, whatever way sounds the easiest for my patients. And then always encouraging a bedtime snack, of course, making sure it's 2 hours out from when you're laying down for bed. But having a couple hundred calories right before bed is a great time to get in a little bit more calories and protein before you're not eating for the next 8 to 10 to 12 hours, depending on how tired you are at this point. And that snack isn't going to interfere with your next meal. So really pushing yourself to have something before you go to bed at night. Having snacks available, especially for long treatment days, especially chemotherapy days. Those are long days, especially if you're traveling for appointments, making sure that you find something that's non-perishable that you can stash in your bag. Always including soft, high-calorie, high-protein foods every time you eat. Some quick examples are cheeses, yogurts, eggs, beans, hummus, any kind of bean dip, nuts, and nut butters. So not just peanut butter, but almond butter if you love cashews. Cashews are soft enough to chew well, but they also make cashew butter. And then fortifying, this word fortifying, as much as you can, and really thinking about food in a new way. If you've never really had to think about what you eat, this can be a learning curve, but always thinking about how you can add things. So if you're used to using a cooking spray, get rid of it. Make sure you're cooking with olive oil. Make sure you're cooking with butter. Fats have 120 calories per tablespoon, so those can really add up throughout the day. Drizzling extra olive oil into soups. A broth-based soup is diet food. It's not going to help you maintain your weight, so how can you add maybe avocado to the top, a sprinkle of Parmesan cheese, always thinking about how you can add more. And then my example with the hot cereal, you know, use whole milk or plant milk to start to make it, not water. Water doesn't have anything to offer. And then drizzling in some kind of nut butter. I mean, those 2 things alone will triple the calories in your oatmeal or in your farina or cream of wheat. And then if you're inserting those snacks throughout the day, a couple of those snacks could be liquid nutrition, so a smoothie or a ready-made oral nutrition supplement. There's so many things available on the market. Ensure and Boost are typically what the hospitals have, but there's so many other options. And if you're a provider and you're making your loved one drink something, make sure you're tasting it is a good example of how there can be some more collaboration between patient and loved ones. Adding protein powder. So you can buy unflavored protein powder. A good one actually is Nestle. They make a unflavored protein powder called Beneprotein that you can easily sprinkle even just a teaspoon of into juices, into drinks, and by the end of the day, you might end up with, maybe another 10 or 15 grams of protein if you can just sprinkle a little bit into what you're eating. More tips on poor appetite. Making sure that you're really capitalizing when you do feel good. Making sure that, I didn't put this one on here, but a lot of times in a social setting, it might actually be easier to eat. You might be a little bit more relaxed. So trying to actually snack on something when you're socializing, using a small plate, downgrading to like dessert plates can be a really good idea if you're eating more often throughout the day so that you're not looking at your normal portions feeling overwhelmed. Limiting the liquids during meals can be helpful if you're feeling full. And then lastly, choosing high-calorie fluids instead of water. So when you're meeting your hydration needs, I think a lot of providers will be talking about water, but actually drinking things preoperatively like juice and milk can be great ways to get a little bit more calories and a little bit more nutrients in. And even taking your pills with some kind of maybe non-acidic juice can be a good habit to get into. A cup of juice might have 120, 160 calories in it. There's juices back there. You can probably look on the label to see how many are in it. Yeah, see? So it's easy to make the liquid calories add up too. Nausea can be a huge issue. So the first thing I like to make sure I go over with people is if they're actually taking the prescribed antiemetic or anti-nausea regimen, and then taking the as-needed medications when you need them before you eat. So going over that, and then thinking about small portions again, and then if nausea is really active, trying to have really low-fat, low-fiber foods. This quick list happens to be foods that have a good amount of salt and have a good amount of potassium, which are electrolytes that can be a little bit lower if people are actively having nausea and vomiting. So things like crackers and pretzels that are salty, yogurt and bananas that have good potassium in them, and that list, we can add onto that list if we were actually working together. And then really the next line, avoiding fried, spicy, and really fatty foods, so keeping it bland. And then as nausea gets better, trying to add some of those things back in. And then again, staying hydrated is so important. You can check the color of your urine, make sure that you're urinating every 2 to 3 hours, and then just, measuring how much you're drinking all day to see how that really stacks up. Skipping meals can actually make nausea worse. So again, eating frequency can be really, really important. And then choosing foods that are cool or room temperature, so they're not emitting odors. Odors can definitely trigger nausea or make it worse. So trying to encourage loved ones and people that are preparing food for you, maybe to give them some ideas of what you might like that isn't necessarily a hot meal. Ginger has been shown to be helpful for nausea, so ginger teas are fantastic. You can also use ginger ale, but adding freshly grated ginger this time of year to soups and stews works really well. You can add fresh ginger to a lot of things. We have a lot of recipes for adding fresh ginger. They also make those ginger candies that a lot of people are fans of. I love ginger, but the ginger candies are actually too intense for me. So I work with people to figure out what works in the whole ginger realm. Lemon is another one. Lemon essential oil can be good aromatherapy, so you can either have fresh lemons at home and dig your nails in and take a whiff of the essential oil, or try adding lemon to your food. Lemon works really well in pastas. Pasta with olive oil, Parmesan cheese, and a lot of lemon. Just that can be really a great, delicious fix to higher nausea day as a lunch or a dinner. And then meditation can be helpful. Going back to the lemon aromatherapy, sometimes I'm not sure if like aromatherapy works because you're doing deep breathing and meditation or if it's the actual lemon, but either way, I'm happy if either one helps. And then just a reminder, if the center that you're going to offers acupuncture or acupressure courses, that can be really helpful too. And then moving on to the bowels, we're going to talk about diarrhea and constipation here. So I think the quick fix for diarrhea usually is the anti-diarrheals and then telling people to follow the brat diet, which the brat diet being the bananas, rice, applesauce, and toast, which isn't enough to survive on if you're having diarrhea frequently and for a long period of time. So my answer to that is thinking about what foods trigger diarrhea, what foods don't. And the big answer really is cutting down on total fiber, so making sure you're not eating super high fiber cereals like Raisin Bran or some of the Kashi cereals, Fiber One, things that have a lot of added fiber. And then thinking about the foods that have what's called water-soluble fiber. So think about what happens when you hit water or oats with water. The oats swell up. If you overcook them, they get a little bit gelatinous. And that gel is the water-soluble fiber. And in your GI tract, it absorbs water and helps to stick your stool together. So it's a common misconception, for example, that bananas are binding or that they constipate, but it's actually just that the type of fiber in the bananas help to stick everything together. So the other foods that have that type of fiber, other than the bananas and oats, are applesauce, peaches, peas, beets, which you have to be careful of because those can make your stools darker in color. And then potatoes without the skin. So these are all great examples of things that you can add every day, real foods that can help to stick your stools together. There's also the option of using a fiber supplement, which is usually my last resort. And then again, on the hydration, making sure that you're drinking plenty of fluids, especially if you're having a lot of loose stools. And then what you're drinking, again, makes a difference. So if you're drinking a broth or a diluted juice with a pinch of salt or a sports drink, those are ways that you can ensure that you're going to hold on to a little bit more of that fluid. And then moving in the opposite direction, if you are having constipation, increasing your fiber intake, so using one of those high fiber cereals or using things like chia seeds or ground flax seeds to add more fiber to what you're eating, and then making sure you increase your fluid intake. And trying warm or hot beverages can help to stimulate your bowels to move too. And then prunes are widely known for having that sugar alcohol sorbitol to stimulate your bowels to move, but pears have some of that sorbitol too. So pears can be a good, another good remedy. Physical activity, of course, gets the core engaged and can help things to move along. And then I like to recommend senna tea for just a little bit of constipation. It's called Smooth Moves. It's a great option if you don't quite need senna, but you need a little bit of help. And then, of course, there's the medications. There's the stool softener Colace combined with the laxative senna. You've probably heard your nurses say sometimes you need a mush and a push, so you need things to be soft and you need it to actually be stimulated. So taking both can be better than one. And then Miralax, of course, over the counter. And then if you're really not moving your bowels for more than 3 days at a time, there's stronger medications that are helpful. And then I always get questions about probiotics. Probiotics can be helpful, especially for IBS or irritable bowel syndrome related constipation and diarrhea. I don't think from the gastroesophageal population I get a question about probiotics as often because there's usually so much going on that people aren't worried about taking as many supplements as maybe some of the other cancer populations. But this U.S. probiotic guide is great because it'll tell you what supplements or what strains of bacteria are actually best for certain conditions and what's actually been studied, and it will grade the evidence, which is nice. So I would definitely direct you towards that guide if you were thinking about taking something. And then, of course, there's always the naturally occurring probiotics. from fermented foods like yogurts, yogurt drinks. Kefir is another great one. And then things like sauerkraut as well, and kimchi. Mucositis and esophagitis can be a big problem and painful. So depending on your chemotherapy regimen, sucking on ice, if you're getting just the 5-FU push, can be helpful. It's called cryotherapy. If you're not getting that chemotherapy, oxaliplatin, that can cause the cold sensitivity, of course. You don't want to suck on ice at the same time that that's going in. And then choosing softer foods can be really helpful as well, and working with someone to make sure you're choosing the right ones is helpful. And then making sure those foods are lower in acid, so avoiding tomato products, citrus, pickled foods, and then also condiments are usually made with vinegar, and those can burn too. And then keeping foods temperature more moderate, so avoiding too hot or too cold, avoiding putting alcohol in your mouth in the form of a toothpaste that can be drying or astringent, and then mouthwashes too. And there's also this supplement called Helios. Has anybody ever heard of this? It's a glutamine rinse. We've had some success at Mass General using this product with our head and neck cancer patients who are getting radiation to their oral cavity or their throat. And then I've also had some success using it with breast cancer patients who are getting adriamycin that causes the same type of mouth sores that the 5-FU can cause. But I think it could probably help with esophagitis too. I just haven't used it in that population. And glutamine is just an amino acid, but the way they've prepared it in this supplement, it gets absorbed better. And it's not too expensive, and it's a twice-a-day commitment, and it's just a rinse, and the flavors are fine. The grape and then the orange tastes like a Tang back from the 90s. And then good mouth care is so important for mucositis and esophagitis. Using a salt and baking soda rinse can be helpful, and using it often throughout the day. I like to have people make a concoction in a bottle and then use it all day. If you're having off tastes, the baking soda is really key. The baking soda can just give you like a neutral palate before you start eating. And then if you're having pain that a topical lidocaine gel can get to, or a rinse can get to by gargling, that can be helpful in some cases. So that's the end of the chemotherapy related side effects piece. And just a reminder to really use your resources. If you're at a big cancer center, there's probably acupuncture, massage therapy, music therapy, yoga, tai chi, or qigong available. And for good reason. I mean, your cancer center is putting those there as a supportive service, but also because there's some research showing that they've been helpful. So make sure that you check those out. And this slide is my single slide about immediate pre-op nutrition called immunotherapy. Not immunotherapy, Immuno Nutrition. So Immuno Nutrition refers to the specific nutrients that have the potential to modulate the metabolic response to surgery or stress by enhancing immune function. And these specific components are glutamine and arginine, which again are amino acids, omega-3 fatty acids, nucleotides, and antioxidants. And these two pictures here are examples of products that Nestle and Abbott, the big industry, big nutrition industry people have made that might have combinations of these ingredients. And unfortunately, most of the research is industry run or industry done. But over the many years that all of the research has been done, the meta-analyses have shown a decreased risk of infection and decreased length of hospital stay. So I think if I was going to need a partial gastrectomy or esophagectomy, I would probably be able to drink 2 or 3 of these a day for 3 to 5 days if that meant I was going to get out of the hospital potentially sooner. So I like to throw that out there as an option for people. So this takes us straight to what happens in the 6 to 8 weeks, or phase 1, I like to call it, after gastrectomy. So at this point, you're trying to eat 6 to 8 times a day, and hopefully you already have eating 6 times a day down by this point. So trying to chew really well and relax while you eat, and even keep a schedule of keeping liquids and solid foods separate, which I think sounds really hard. So I'll show you in my next slide. I have just an example schedule, and then I'll go through with people what their preferences are after surgery and how to plug in what to eat and when. Because I think the whole time frame of keeping fluids 45 minutes to an hour before and after eating sounds like a lot, just thinking about it. Laying down for 15 minutes after eating can help to slow the movement of food through your GI tract. And at this point, everything should be soft, well-cooked, low fiber, so avoiding raw fruits and vegetables, and then making sure that there's enough protein, again, to help with healing. So still on this phase 1, 6 to 8 weeks post-op, avoiding high sugar foods can be important to prevent that dumping syndrome that we're going to talk about in a minute. And then avoiding sugar alcohols that can cause a lot of GI distress. So as for example, xylitol and mannitol are in a lot of gums, hard candies, anything that says sugar-free might have these sugar alcohols, and that can cause a lot of upset stomach, especially after surgery when things are more sensitive. And then the sugar substitutes that would be okay would be sucralose and aspartame. So I think, if you wanted to get something sweet and then not have the dumping necessarily, you could choose those. And then high-fat foods immediately after surgery usually aren't appealing anyway, but they can definitely cause discomfort. And then limiting concentrated sugar from fruit juice and from fruits can be helpful as well. So this is my little schematic of what it would look like to get 2,200 calories in a day and 85 grams of protein, and the spacing, starting eating at 8 a.m. all the way through 9 p.m., which I know sounds like probably a long day of eating, but the portions are small. So again, I like to use this and just kind of plug in what works well for people and what people's preferences are. So this is phase 2, when people aren't experiencing as many symptoms and you find your portions can creep up. You might be able to eat a cup or more of food at a time. And then at this point, you can usually start introducing some fiber, and you can start introducing really small amounts of soft, more well-cooked fruits and vegetables. And if you're still actively losing weight and you're planning on meeting with a dietitian, trying to log your food can actually be helpful for the dietitian, and you might actually find it's helpful for you to figure out what's going on. I really like this one called Chronometer. MyFitnessPal is super popular if you want to log your food too. They're both very easy to use. So the common problems tend to be early and late dumping syndrome. Early dumping syndrome happens 15 to 60 minutes after eating, and this could be caused by your body's response to any concentrated sugars going into the small intestine too quickly, and then your body is trying to dilute that sugar by pulling fluid in, and that can cause cramping and bloating, nausea, diarrhea. It can even cause low blood pressure and make you feel weak and faint. So the remedy to this is avoiding concentrated sweets or sugars, and having some kind of protein, and then maybe even laying down to help avoid gravity from keeping things moving if possible. And then the late dumping syndrome happens 2 to 3 hours after eating, and this happens because, again, food is moving too quickly through the GI tract, and your intestines are absorbing sugar into your body quickly, causing a higher blood sugar, and then your pancreas releases insulin to meet that high blood sugar, and that can cause a low blood sugar, and that can make you feel dizzy or weak or faint, and that can happen 2 or 3 hours after eating. So it's kind of the same remedy for the late dumping syndrome, where you can just make sure you're not eating sugary foods and making sure you're eating a mix of proteins and fats with the sugar too. Another common problem is malabsorption. It's not as common with esophagectomy, but with total gastrectomy, this can definitely happen. If you're having light-colored stools, stools that float in the toilet bowl, if they have a really bad odor, you might need a prescription for digestive enzymes, and they can be really helpful at making sure you're finishing the digestion of your food so that you're actually absorbing the food into your small intestine and that you're finishing the processing of the food that you just ate. Another common problem after any GI surgery and sometimes even after a lot of chemotherapy is lactose intolerance, which you're probably lactose intolerant if you're having bloating, cramping, and diarrhea within 2 hours of eating or consuming milk or milk products. There are low lactose foods that I try to work with people on incorporating if they are lactose intolerant, because you don't want to get rid of a whole food group necessarily. So this is just a list of the alternatives on the right-hand side that you could replace your typical dairy foods with. And then you're also at risk for nutritional anemia due to malabsorption of B12, folate, and iron. So these are things that should be checked in your lab work regularly. And I do have a printout of specific supplements that I have people take for B12 specifically and as a multivitamin. And then if you're taking enzymes, you definitely need a fat-soluble vitamin as well, which leads me to think about dietary supplements. So we know there's so many beneficial compounds that have shown to have positive effects when they're actually consumed as whole foods. And then when we start extracting individual nutrients out is when things can actually be problematic. So we know that supplements are not regulated or tested and that they can be harmful because they can provide really high doses and then interact with treatment potentially. So just a word of wisdom. For example, turmeric has been shown to inhibit the action of cyclophosphamide, which is a chemotherapy. So just a word of wisdom. If you're going to take a supplement, definitely let your providers know. This is available from the Harvard School of Public Health, and it's the Healthy Eating Plate. This is my favorite go-to for healthy eating, and I think I'm running out of time, so I'm going to wrap it up. I wanted to go through nutrition myths, and I'm happy to answer questions about these later. Again, I feel like with this diagnosis, there's so much going on that a lot of times people aren't wanting to do the ketogenic diet or celery juicing, and I think it's usually not as much of a concern, but I'm happy to answer questions about these as well. And then just lastly, this is a list of resources that includes the Memorial Sloan Kettering About Herbs for Supplements. That is a great resource for patients. And then our Mass General Nutrition website, and of course the Dana-Farber Cancer Center, their nutrition page. And then they also have a great app for recipes and side effects that's really great. So that's it for me, I think. Thank you. I don't know do I have time for questions?
Yes.
I buzzed through the last
Thank you so
part.
much. Thank you so much,
No
Carol. That was
problem.
great. Just want to remind everybody to write their questions on the index cards, and then those will be passed down for the panel discussion. But I do think we have time for one or two questions if anybody wants to raise their hand. Yes, this gentleman here. Let me give you the microphone.
Okay. When a patient has symptoms that are similar to a psychological panic attack, shortly after eating, shortness of breath, sweating, heart palpitations, fatigue, what do you interpret is the cause, particularly if the patient is not eating sugar? And how can those symptoms be prevented?
So in that case, I would probably bring in one of my colleagues, either probably starting with social work, and then it usually takes longer to get an appointment with an oncology psychiatrist, but that's usually the avenue I would take to figure out, if it's not the food, then definitely working on the mental piece.
No, it's not the
It's
mental
not the
piece.
mental
I know the patient intimately.
Oh, okay.
She's my wife.
Yeah.
It is not psychological. What I'm saying is the symptoms exhibit psychological symptoms of the panic attack, as though something that she's eating may trigger the vagus nerve to give
okay.
those symptoms, and it's not sugar.
Yeah, I'm not really sure. Have you talked about it with the oncologist or surgeon? Yeah.
Yes.
Yeah. I'm happy to talk to you after too.
Yeah,
Yeah,
I
I'm
haven't
sorry.
found anybody who can answer that question.
Yeah, it sounds like a very complicated
Yeah.
situation. I'm
Yeah.
listening to it myself. I'm not quite sure if there were, I think there would be a few things one could try.
Yeah.
But I think that it sounds like a very difficult problem, so.
Yeah, yeah.
But we'd
Thank
be
you.
happy to discuss that further with you